Okay, yesterday was Berberis aquifolium. Got to stick to the subject because I got a lot here, which is the Ora grape. Today is Berberis vulgaris, which is barberry, another plant. The usual preparations of Berberis vulgaris are made from the root bark. Affections of the liver and kidney are strongly marked, but Berberis is a medicine of wide range, so like a polycrest. That's what they call a polycrest. It's good for a lot of different situations. On the indication, tumors and sessile growths. Those are just basically almost like tumors too. Ozanum, somebody, a homeopath or whatever, cured a case of polyps on vocal cords, and that's what that sessile is, like polyps and things. Red with sessile base. I no need to get into all that. Thuja had failed, but so anytime you got warts or you got growths or things like that, Thuja is usually the medicine. But Berbis 200C was given at first with good effect, and it might have had some aggravation or something, but the potency being gradually reduced. So they were reducing the point from 200 to maybe 30 to all finally got down to with increasingly good effect until the growth disappeared entirely under the 1x. So he might have just started with a 1x and gone with that. He might have got aggravation with a 200. So a lot of times we think, okay, we get a 30 and we get a decent response, we need to go higher. A lot of times we got to go lower. So yeah, a lot of homeopaths have troubles, and I always hear them when I'm on these calls asking, which potency? What potency do I give? It can be, you give the potency you have, and if it's aggravating, you can stick it in water. You can have them pound it and pound succuss it, which is pounding it, and then take it as frequently as you need to. And if they get aggravated or something, or they're not getting as good of results, or they're getting it's too strong, you back off. So if that's all you got now, if you're giving them potency and it's you know working, but not the way it should, you might back off to a lower potency, or you can go to a higher potency. So it's a matter of trying and testing. Each person's individual and you never know. But whatever potency you have, if you stick it in water, it will do what it needs to do. B. Simmons has verified a symptom of Berberis. A gentleman of 52 complained of rheumatic pains. See, that's why I say it's not only liver and kidney and all that kind of stuff, but it's also in tumors, but rheumatic stuff in his legs and loss of walking power. After he had walked a short distance, he was compelled to stop from a feeling of intense weariness, heaviness, lameness, and stiffness. Now, stiffness sounds like Russ talks. Of the legs, which felt sore as if bruised. A single dose of Berberis vulgaris, a complete cure, improvement commencing on the fourth day. And it's interesting because the guy I was studying with in Iceland, that call, he said, always wait, 3 days. After the third day, you see improvement or you don't. So it's interesting that this guy said it commenced on the fourth day. Now he said not only the third day, but 3, 6, 9. It's always in threes. Three seems to be a magical number. Stuart Close, another homeopath or whatever, records the cure with Barbarius, Barberis, Vulgaris, 200C of a woman who had cutting, burning pains in the balls of the feet on stepping. So there's a lot of medicines for that. What do they call that in the feet, in the heels? Um, f- um, I forget. Anyways, on standing with most of the weight on the heels, she had no pain. So she stood on the heels, had no pain, but she had pain, when standing flat-footed. On rising in the morning, sensation in soles as if stepping on needles. Now, my wife said she feels like she's stepping on a stone. So, that would be interesting to try this medicine. It acts well in fleshy persons, good livers, but with little endurance. Prematurely old and worn out men and women. So it's great for, anybody who's old and worn out. Berberis vulgaris may be something you think about. Old gouty constitutions. suited to bilious diathesis, which is more nauseous, throwing up type of stuff. Cases where kidney or bladder symptoms are prominent. So that's what, and the kidney and bladder symptoms can lead to the backache, can lead to the pains in the chest and the things, different things. So, that's why I say if you have something on the skin and you push it in, it could go to the kidney. Now you have kidney problems with pains in your back or in your chest or, rheumatic pains or something. And then when you give it, it clears up the kidneys, clears up the rheumatic joints, and it'll, because it'll go from the most vital organ to the least vital organ. So, if it goes from the kidneys and that, now the joint, you still have that rheumatic pain, you keep giving Berberis, and the rheumatic pain goes away because it's rheumatic, and not only in the legs, but the finger, the hands, and the feet. They have a lot of rheumatism. And it'll go from the kidneys will get better, and the pain in the back will go away, and then the rheumatic pains will go away, and then maybe you end up with some skin stuff. It'll be pushing things out. You don't have to have skin stuff, but it could end up there. As long as you don't put nothing on it, you allow the skin stuff to clear up, all that stuff will be gone. So, Berberis vulgaris Barberry plant. Inflammation of kidneys, and they're using mainly the root, they say, the bark of the root. Inflammation of kidneys with bubbling pains, a lot of bubbling, whether it's in the back or in the, but there's a lot of bubbling down there. That's a 3 when the kidneys are inflamed. And of course, you're going to have urinary stuff going on and all that. Severe kidney stone pain. I wish I'd have had my kits, and I don't even know if the guy would have been into it, but we were driving to a church meeting and conference in California, and all of a sudden he looked at me and goes, "Tell him to go to the hospital." Really? Are you serious? Yeah, yeah. Just tell him to go to the hospital. And we went. He had kidney stone, and basically he laid in bed for 3 days, sweating and in pain and all that kind of stuff. So, you know, you'd be surprised at how quickly a homeopathic medicine could overcome that. Pains are radiating. They're radiating out of from the back, the kidney, and they radiate all over. They're changing places and they're all over the place. Gallstone colic. So they have gallstone problems too. And colic is just that pain, like if baby has colic in their stomach, they're crying and screaming. So it's gallstone colic. Pains in the gallstone, kidney pains, worse motion. Standing brings on increased urine. So that when they're standing up there, you have to urinate a lot. Worse jarring, stepping, night urinating with fatigue. So they're very fatigued because they're always waking up and having to urinate. And it's worse sitting. So worse jarring, stepping, sitting, and so anytime they take a step, that jar would really aggravate them. And they have this night urination with fatigue. So they can't sit, they can't stand, they can't jar. Otherwise, it brings on that urination. Mentally, physically tired, probably because of all the urination. Mental work is difficult for them. They're indifferent and they have apathy. They could care less about whatever's going on. I mean, they got a lot of crap going on for themselves. So whatever's going on outside of them, it's like, who cares? And they can't do no mental work. They're just mentally and physically tired. Gallbladder and kidney colic, that's a 3. So there's that colic again. That's just pain down there. Arresting breathing. So that pain really causes them, they breathe and that pain is worse. Stitching pain in kidneys to liver, spleen, stomach, and groin. So these pains radiate out of the kidney into the liver, the spleen, the stomach, the groin, and it does go to the back. Bubbling sensation in the back, and that's most likely from the kidneys. That's a 3. Numb, bruised sensation in the back, and lumbago, which is a lower back problem from either overuse or strain or whatever. Antimonium tart, rust tox, and Berberis vulgaris would be considered in that situation. And there's probably a couple others that could work. Stitches in neck, back, worse respiration, post-operative pain. So after they have an operation, I guess in the back, yeah, that's got to be the back operation. This would be good. Berberis would be good for that pain. And calendula, you'd think of a few other remedies too. But, that's why when you see these antimonium tart, rust tox, and lumbago, you'd be choosing according to antimonium tart has a lot of lung stuff. And it sounds like This has a lot of kidney stuff. So if you're relating the back lumbago to kidneys, Berberis vulgaris. If you're relating it to the chest stuff, you'd consider antimonium tarp. Rus tox, it would be stiffness. So these are the keynotes that would help you to determine between these medicines. And that's the whole idea. You're talking to a person, you get a lot of these symptoms. Now you're going in and you're figuring out which one would work best for their situation, because we have, like I always say, you have a headache, I got 30 remedies. I got to figure out, is it a gastric headache? Is it a stress headache? Where's this headache coming from? What is the situation? Is it from your periods, your vagina, PMS, all kinds of things. Oppression, especially at night. Once you get the center of the case, like my mentor, I got to quit going off topic here. My mentor had a lady that had PMS. She'd come in for back pains. And the center of the case was PMS. So he took care of this, took care of that, and finally at the end, the PMS, things weren't going away. The PMS wasn't going away. Her sleep got better, different things. And that's why you give a medicine, you'll see different things like sleep get better, or the pains get better. And finally, at the end of everything, you'll get rid of that PMS. The back pain will go away. The PMS will go away. So, it can be quite an ordeal to get through a lot of stuff when it's a chronic situation. Oppression of the chest, especially at night, with violent flow of coryza. Now, coryza is different than catarrh. Catarrh is thick mucus. Coryza is thin mucus. So they've got a lot of mucus coming out. They're urinating at night, and that's why they're tired, worn out, and they just want some rest. Pain is shooting in the left side of the chest, tearing stitches in chest and heart region. So then these can be coming from the lumbago, from the kidneys, from these, or it can be coming from the chest area down into that area. So it can shoot either way, up or down. Itching it's got wiped out, and I forgot what that was. What is that? The ears. Itching ears is itching with, what the heck are you? Itching with small pustules. Is that what it is? Yeah. Itching with small pustules on the outer part of the ear, enlarged glands around the ear, stitches and shooting in the ear. Eyes have aching with burning, sunken and bluish circles. So their face has this sunken, their eyes look sunken, and they have these bluish circles around them, probably from not sleeping, but they have this aching, burning in the eyes. Itching in canthi, which is the white of the eyes. Eyebrows, itching in the canthi, eyebrows, and lids. So they got a lot of itchiness in the eyes. Face is sunken with cheeks and eyes with bluish circles. Okay, so the cheeks are sunken, the eyes are sunken, they have bluish circles around the eyes. So that's why I always say, you got someone coming in, you see their face, and it's like, you see, you get an idea of some remedies that would come up. Then you have they're either heavy set or thin or whatever. You get a sense of what's going on with them, if they're underweight, overweight. Then you see their tongue, and their tongue has a coating on it. That can lead you to remedies. You look at their lips, they could have herpes on the lips, crack in the middle of the lips, crack on the side of the lips. All these things. That's why these Indian doctors they're able to come in and just look at a person and say, oh, give them this, arsenicum, arnica, apis, allium cepa. They can just from looking at it, and sometimes they'll ask one question and that'll clear it up, and they'll tell them what medicine it is. So that's years of experience. Let's see, vagina is sensitive, and they have vaginismus. Vaginismus is a pain during sex. The vagina, kind of contracts during sex, and they just don't enjoy it. They have burning and soreness in the vagina. Menses are gray, mucus with brown blood. So they have gray mucus with brown blood in the menses. They also have leucorrhea. The leucorrhea can have a grayish look too. Neuralgia in the vagina and ovaries. Dysmenorrhea, blood is gray. So there's a lot of bleeding, with this. And the blood is gray, the mucus, with a gray mucus and it can be brownish blood. And leucorrhea is gray also. So there's a lot of gray down there coming out. Acrid, bitter taste in the mouth, especially after a meal. So their taste is acrid and bitter. Excessive appetite, like bulimia. And bulimia is they have this great hunger and they gouge themselves. They eat like crazy, but then they go and they regurgitate it all. They make themselves throw up to get rid of it. And like anorexias, they don't want food because they don't want to get heavy. So, but bulimia is, these are both quite bad mental illnesses that a lot of women have. A one of appetite. Now that can be an anorexia. So they can have either the anorexia or the bulimia situation going on. Frontal headache, chilliness back and occiput. So they got this headache, but they got this chilliness. The chill is in the back, up the back, and in the occiput in that area. Worse movement, better open air. Sensation of a tight cap pressing on whole scalp. That's a 3. So usually it's a band, so it'd be a thin band around the head. This one's the whole head feels like it's has pressure, just like a cap on there. So that's a 3. And that's most likely in headache and stuff. Squeezing with shooting pains in the heart, palpitations and stitches. So they get these stitching pains, and it's like a squeezing, shooting pains in the heart. Pulse is very slow. Okay, the kidneys, big kidney remedy, radiating pains, colic from kidney stones, bubbling sensation down there, tight thighs, loins, tight pain in thighs, loins on urinating. So when they urinate, the thighs and the loins ache. Man, I smell cigarettes, dang it. I hate them. Neuralgia under fingernails, that's a 3. Rheumatic aching in hepatic region, that's the liver. Worse pressure. So they've got, for whatever reason, neuralgia under the fingernails. So that's like a nerve pain under the fingernails. They would call that Wens, I think. Or is that Wens? Yeah, I think it's Wens. But anyways, rheumatic aching in hepatic region, worse pressure. And there's also rheumatic in the metatarsal bones, which is the feet, and the I forget what these ones are called, but these bones in the fingers. So there's a lot of neuralgic pains in the fingers, under the nails, in the like, and I'm surprised there's a rheumatic pain in the hepatic region. You always think of rheumatism in the joints, but it also can be in the liver and the different areas like that. Worse from pressure. So anytime there's pressure on it, they would scream out. Gallstone attacks with severe pains. I don't know why this hepatics in the liver in the limb area. Gallstone with attack pains is in the liver region. That's kind of weird. But anyways, that's a 3. Gallstone attack with severe pains. Catarrh of bladder with constipation and yellow complexion. So that's more like jaundice. But they have a lot of like mucus type of stuff in the bladder, and they have constipation. Let's see, expectoration. Okay, lungs, increased deep breathing with dry cough. So they're not coughing up anything, but they have this, they gotta breathe deep to get the breath they need. Hoarseness, polyps in the larynx. That's, well, anyways, short dry cough. Expectoration is thick yellow jelly-like mucus. So this could be calibic, hepersulf. A lot of different medicines would relate to this. Calibic, they have a hard time getting up mucus, and this says a dry cough. So there's obviously not a lot of expectoration, and that's why, because it's thick and it's yellow and jelly-like. Genitals are cold and sweaty for the male. Neuralgia, which is nerve pain in the spermatic cord and testicles. Prostate gland is enlarged with pressure in perineum. That's the area between the genitals and the anus. There's a lot of pressure down in there. Prostate gland is enlarged. This could be one for my dad. Berberis, Vulgaris. Now I can't ask him questions. If I could ask him, where's that kidney? Urine. What's your urine look like? You have pain when you have urinating, things like that. I could determine the right medicine, but I'm just giving him sal palmetto for now. See if that helps. And I haven't seen him. I didn't see him run into the bathroom as often. He did it like 3, 4 times the other day. Now he wasn't doing it. He wasn't running there as quick yesterday. So we'll see. I'm gonna take up another. I'm giving him a 3C, a spageric 3C of saw pimento, which is, I forget what the name of that medicine is, homeopathically. Um, Burning and acrid taste in the mouth. That's, when eating or whatever, there's just all this burning and acrid taste. Sticky, viscid, foamy saliva like cotton. So they have like cotton mouth. Nux muscata would be one you'd consider with that. Vesicles on the tongue, so they got sores on the tongue. Gums are dirty gray, so when you look at their gums, they wouldn't be bright red, they would be dirty gray. Tongue is white, and that's why I say when they look at, you look at a person and you see the sunken eyes, the blue rings around the eyes, you sing, you tell them to stick out their tongue, it's white. Gums are dirty gray. That would lead you to a bunch of medicines, but Berberis vulgaris it would lead you to dryness of the nose with obstinate catarrh. Now that's thick mucus. They've got thin mucus. Where's the thin mucus? Lungs. Expectoration thick. I don't know. Where the heck did I see that kid? Other one. Oh well. Anyways, dryness, obstinate catarrh, left nostril. So mainly the left nostril can be the right, but it is mainly the left nostril has a lot of catarrh. Always has catarrh coming out. Coryza with yellowish discharge. Now there's the coryza. Okay, coryza has yellowish discharge, catarrh in left nostril. So that catarrh is more thicker, coryza is more thin, but it is yellowish, whitish, yellowish, greenish mucus, especially in the morning. So when you're whitish, it's not you got a situation. When it's yellowish, you got an infection coming on. When it's greenish, it's really an infected area. So just a little side note there. Hard stools like sheep dung. So there's that constipation. I don't know where the heck that is. It's up in the. Anyway, I think it was in the kidney. Constipation. Oh, man, I don't need to go there. With burning in anus. So that sheep dung, they're having a hard time. They probably, undoubtedly, they got some. They have some hemorrhoids probably coming on from all this pushing and not going to the bathroom. Tearing around the anus. Fistula in anus, those are cracks, or a tunnel is what it is. It's a tunnel. So, it's like the anus, something opens up to where, the stuff's leaking out into another area. Itching with chest complaints. So why is there, itching of the anus with chest complaints? So it's interesting how these things, they relate these things, why the chest complaints relate to the itching in the anus, but it does, there's a lot of years of experiments with this stuff and just getting to know it and knowing that this stuff relates to each other. Flat warts on the skin. You would think of thusia, but Berberis vulgaris would be another one. Itching of the skin, that's a 3. A lot of itching, burning and smarting. So when they're itching and they're scratching, they get burning and smarting afterwards. That's a sulfur situation. When you scratch with sulfur, you get a burning situation. Worse, scratching. Okay, the burning and smarting is worse from scratching. That's what I was saying. So they're itching, they scratch, and then they get this burning and smarting sensation. Better by cold, so they want cold applications on it, which relieves that itching. Eczema of anus and hands. So that's interesting. So the hands have eczema on it, and the anus has eczema. Circumscribed pigmentation following eczemaceous inflammation. So they have inflammation on the skin, some kind of whatever, infection or pustule or whatever. And then they have a brown spot that forms there. So a circular brown spot. That's what circumscribed is, circular pigmentation. That's like a brown coloring. That's a 3. Sleepy in day, and that's probably because of all the stuff going on at night. Restless, disturbed sleep. Skin itching. So that all that itching of the skin, and of course they're urinating at night. they're not getting sleep, which makes them mentally, physically tired, and they just aren't functioning well. Heartburn and nausea before breakfast, better after they eat. That's a 3. So they wake up and they got this heartburn, and then they come down and they get something to eat, and that heartburn goes away. That's a 3. Pain in stomach to back or vice versa. So it can go from stomach to the back or back to the stomach, and it can shoot from the top to the bottom and from the bottom to the top. So there's a lot of shooting pains going on all over. Burning and shooting and sticking pains in the stomach. Temperature, they're chilly and they have a cold sensation in various parts. So one part can be cold and another part can be cold, so it changes. Warmth in lower part of back, hips, and thighs. So there's a lot of warmth down there, and there's pain. So where there's pain, there's usually a lot of warmth. Inflammation in tonsils and pharynx with swelling and fiery redness. So this is good for all kinds of tonsil stuff. Pharynx, like it said, it had a well, I'll read it. It takes off well, I did read that. It took a pustule or whatever off the pharynx. Hoarseness, I forget what that was. It took that the guy cured off the pharynx. With vertigo, with faintness and weakness. They got a lot of confusion and heaviness of head. 26. I got time. I did good. I didn't go off into tangents like my dad's situation. My wife now has another situation. She got a pain in her right shoulder, under her right shoulder blade. And you could tell it's an infection in the ear, so I gave her some mercury this time. The neck pain was better, but this is all undoubtedly related. So I have to sit down and figure out. And I ask her questions. What's the pain feel like? And she just doesn't want to answer. That's a symptom. They don't want to talk. They're like, just leave me alone. So that is even a symptom of that you can use to find a medicine. What would you say? Not wanting to answer questions, not wanting to talk or whatever. Okay, Berberis vulgaris. A lot of reading to do. The mental condition of Berberis is one of indifference, apathy. There is aversion to the darkness, terrifying apparitions in the twilight, melancholy with inclination to weep. So they are just melancholic and they just weep. In the head, there is a vertigo and heaviness, darting and shooting pains, often changing their localities, worse movement, better open air, heat of head after dinner or in afternoon. So after they eat or somewhere in the afternoon, they get this heat in their head, puffy feeling in head, as if it were becoming larger. Scalp is tense. That's like that cap on the head, it said. The face is pale with dingy gray tinge. Sunken cheeks, deep set eyes surrounded with bluish and black gray border. And there's a few remedies that have that sunken and bluish black gray stuff. But, you'd have to use the differentials to figure out which medicine would be. Mouth is dry and sickly, painful, white blisters on tip of tongue. The pit of the stomach is puffed up. Gnawing pain in right hypochondrium, that's the lower part of the abdomen on the right. Shooting pain to the left scapula. Interesting. That's what my wife has right now. Pains shoot down from the 10th rib to navel, burning in either inguinal region, especially the right. So the right inguinal region, the right hypochondria, there's a lot of shooting, burning pains. And then from the hypochondria, it's shooting up to the left scapula. My wife's not saying anything like that. It's just right there in her, it's in her right scapula. That's right. Berberis produces both constipation, sheep dung stools, and diarrhea. That's why I say it's not a contradiction to it. It's, it can be either or. And a number of symptoms about the anus, hemorrhoids with itching or burning, particularly after stool, which frequently is hard and covered with blood. So they're having bleeding stools because it's so hard. Anal fistula, which is a tunnel going out with painful pressure and perineum extended deep into pelvis on the left side. In the female, a marked symptom is absence of pleasurable sensation during sex, uterine symptoms and leucorrhea associated with painful urinary symptoms, dysmenorrhea, which is a lot of bleeding, pains radiating in all directions, down thigh, etc., vagina intensely painful, reddened, violent pain in back, and menses which are too scanty. It is a leading remedy in lumbago pains, extended from back, round body, down leg, with red sediment in urine. So this is all coming from the kidney. Numbness, stiffness, and lameness in kidney region. Many old troubles in the back, sufferings worse by fatigue. Aching in the small of the back, worse sitting or lying in the morning on awakening. Neuralgia under the fingernails. Mucous membranes become dry, uh, mouth, vagina, etc. All these mucous membranes become dry. Discharges or skin is dirty gray, and the gums are gray. Cold feeling in the bones, eyes, ears, etc. So there's a lot of coldness. Numbness, insensible to extreme heat and cold. Chest affected after operations. Hemorrhoids, fistula, etc. Metatarsus and metacarpus feel sprained. So those are the bones in the hands and the feet. There is great weakness like fainting after a walk with perspiration and heat on the upper part of the body, cold, pale, sunken face, and oppression of breathing. Great relaxation with disinclination to do anything. Great sleepiness during the day and after dinner. After riding, much great sense of weakness in kidney region, so they can't take that bouncing. Guernsey admirably sums up Berberis as follows. Affects particularly to the lumbar region, kidneys, uterus. The patient is sometimes unable to tell the exact locality, but the pain is somewhere in the back and shoots up the back or into the spermatic cord or testes, bladder, buttocks, or legs. So this pain shoots around. The pain may shoot up or down or both ways. Pains may be felt all over the body, emanating from the back, and pains are of a sticking, pricking, sharp, or jerking character, flying about now here and then there. There is often a bubbling sensation in the region of the kidneys. I'm over by 2 minutes. That is Berberis vulgaris. That is morning medicine. You can age, but you don't have to get old. Yeah, that was